Welcome back. My name is Dr. Carl Baird, and today I'll be teaching you how to perform the hip hinge movement by going over some of the most common mistakes that people make while they're learning this movement. Because for such a simple movement, there are a lot of very small things that can go wrong that can actually contribute to joint pain, when the reality is we want to use this movement, and it is such an important movement to help limit impact on your joints for less joint pain and less arthritis as we get older. And so we want to make sure that we get the form absolutely correct before we start moving to weighted or more difficult variations of the hip hinge. So with that being said, let's go ahead and get started. The first mistake that I see people make is when they bend their trunk forward versus reaching their hips backward. So again, with this hip hinge movement, we really want to focus on sending the hips back. And so what I mean by bending the trunk forward is some people, when they're performing this movement, instead of reaching my hips towards the back wall, they bend forward at the trunk here. So my hips aren't really moving, but I'm bending the trunk forward. And technically, that is a hip hinge, but if we start to add any weight to this movement, it pulls our center of gravity so far forward that you're going to start feeling low back pain here. So when you're learning how to hip hinge, make sure that you focus on reaching your hips towards the back wall and not bending forward at the trunk. Now, the next thing you have to pay attention to is your knee movement. And so there's a couple things that can go wrong with knee movement. The first that I've seen is a lot of people lock out their knees. So they lock out their knees and then they send their hips back like they're supposed to. But again, it shifts my center of gravity. So if I were to add any weight to this, it's going to be uncomfortable in my lower back. So make sure that you have loose knees and you allow your knees to bend. But then on the flip side, we don't want to turn this movement into a squat. So the other mistake I see people make is as they're sending their hips back, they also bend their knees, and it basically becomes a squat, which is not what we're going for. We're going for a hip hinge, so most of the movement should be in the hips. So the key here is that you find that middle ground, that little sweet spot where you allow your knees to bend, but you're not actively bending them. So let me show you what I mean. Again, my knees aren't locked out. I start with nice loose knees. I send those hips back, and you'll notice I'm allowing my knees to bend. So there's a slight bend in the knee, but I'm not actively bending them like a squat. So that's the key. You want to allow your knees to bend while not actively bending them. So keep giving that one a try. That one takes some time, but really pay attention because it's really important. The next one is an easy fix, and that is when people go too low with their hip hinge movement. So as they're performing their hip hinge, if you remember, I mentioned at the beginning, you want to stop when you feel tension at your hamstrings, because the reality is I could go lower, but what happens is I start to round at my low back. And if you're somebody that's already experiencing low back pain, that can be uncomfortable. So one of the benefits and good things that the hip hinge teaches you, it teaches you how to keep a neutral spine while performing more dynamic movements. So we need to make sure that we keep that neutral spine. So what you'll want to pay attention to as you go down is stopping right when you feel that slight pull in your hamstring. So it might be harder to feel when you don't have any weight. It'll be easier to feel once you start doing weighted variations of this exercise. So you really have to pay attention. I'm sending my hips back. The minute I feel tension in my hamstrings, I'm coming back up. So avoid going too low to avoid that lower back rounding. Now, the next mistake is a little bit harder for me to demonstrate because it usually happens in people that are hypermobile or hyperflexible, which I am not, but I'll do my best to show you what happens when they're learning the hip hinge exercise. That mistake is that they overextend at the mid-back. So as they send the hips back, they extend at the spine, and that usually creates tension right here in the middle to low back. And so let me show you what it looks like with this PVC pipe, because sometimes that makes it a little bit easier to understand. So when you put this PVC pipe on your back, to get into neutral spine, it should be touching 3 points: your pelvis, your mid-back, and the back of your head. And what happens in people that are hyperflexible sometimes is as they send their hips back, they overextend at that mid-back, and you lose that touching point in the mid back. And so an easy fix for this one is, for somebody that's hypermobile, is to just brace your abs when you're performing this hip hinge movement. When you have that slight contraction in your abs, it almost holds everything together and prevents your rib cage from flaring out and that overextension at the mid back. One of the more common reasons people experience low back pain when they're learning the hip hinge is this mistake, which is really small and really subtle. So we want to make sure that you're not doing this. And so what it is when your pelvis rocks forward when you initiate the movement. So again, this is a really small, subtle movement. It might be hard to see. I'll do my best. But what happens is when I reach my hips back, my pelvis rocks forward and I get that extension in the low back. So anytime my pelvis rocks forward, it creates extension in your low back. And you'll notice it right away. Like even me standing right here with my pelvis rocked forward, it's really uncomfortable. So if I added any weight to this, it would be pretty painful. So if that is you, where anytime you initiate that squat, you immediately get that lower back pain, pay attention to your pelvic positioning and make sure that your pelvis isn't rocking forward. And you can do that with the same strategy that we used for overextending into mid-back, where again, you just hold that slight brace in your abs. That'll hold that pelvis in place so that you can keep that neutral spine when you're performing the hip hinge. So now let's put it all together so that you can learn how to hip hinge properly without any of these mistakes causing more pain when we're trying to use this exercise to alleviate pain. So let's start. My feet are hip width apart. And again, make sure I initiate the movement by sending my hips back and not bending forward at the trunk. I have that slight brace in my abs. That'll avoid any overextension at the mid back or that pelvis rocking forward to create that pain there. And again, my knees, I want to start with loose knees so they're not locked out, but the movement is reaching my hips back. So you'll get a little bit of knee movement. I'm allowing my knees to bend, but I'm not actively bending them like the squat. And lastly, just pay attention to that tension in the hamstrings and stop when you feel it to avoid going too low. So just so you can see a couple reps, what it looks like, hips back, slight brace in those abs, keeping that neutral spine, and again, stopping when I feel that tension in the hamstrings and coming right back up. Hips back, tension in the hamstrings, neutral spine, come back up. So again, for such a simple movement, there's a lot that can go wrong or that you have to pay attention to. Don't get frustrated. Just keep at it. And the more repetitions you get, the easier it will become. There you have it. That is how you perform a hip hinge, by avoiding some of the most common mistakes that people make when learning the movement. And I just want to reiterate before we go how important the hip hinge movement pattern is for a couple reasons. One, it teaches you how to bend forward while limiting impact through your joints, which again is really important as you move throughout your day. But it's also a foundational exercise that's used in a lot of different strength training exercises, from RDLs to squats to deadlifts. All of these big strength training movements, we use this hip hinge. And so it's important that we get the proper foundation, the proper fundamentals before we start adding too much weight. Because if we don't have that and then we start adding weight, that is how we injure ourselves. So that's all I got for you today. Again, if you do have any questions, leave them in the comments below. I'm happy to answer.